Thanks for the heads up, Sarah. It helps when you turn the microphone on. All right, here we go. Welcome to the Friday live dog and pony show. That should solve and remedy that. I see your volume is up. Great to hear that, Sarah. Thanks for sharing. There you are. Yeah, there we go. We're back. Wave at a couple people over here. Hi, Hope. Looks like our neighborhood naturopathic has joined us. Welcome everybody to the live Q&A. Punctual as always this Friday's happen for us here as far as Secoya goes. I'm just doing too many things at one time, so you guys are great for joining us. Oh, there we go. Just got to adjust the lighting here. Hopefully it's adequate. So we got a lot of good stuff. We're going to talk about some elderberries, some earwax, shopping lists, stress, QNRT, more QNRT, nausea, and then cookware, okay? We got a lot of stuff to talk about today, so we'll do this as efficiently as possible and get everybody the adequate information that they're desiring so they can feel empowered to live their best life, as we always strive to do every day at Secoya, whether we are with you in person or remotely. That's our goal, that's our mission. Everybody likes a piano, but I'll turn that down because it's getting a little loud. All right, hi Amy. Okay, so let's start off the live Q&A today with your take on elderberry. So our participants asking, what's the take on elderberry syrup and or supplements? So basically, elderberry can be really good for certain people, hi Cami, that are dealing with throat issues, okay? So it's a general immune booster. If you think about it, it's an antioxidant and things like that. Happy Friday, Amy. It can be a good adjunct therapy. I don't know that elderberry is necessarily curative of anything. Ultimately, if your throat's having issues, if you have a sore throat, specifically that's why you might be taking elderberry syrup. It is probably because you either have a concept or an issue in life that's too big to swallow, or you have something stuck in your throat you're not able to say. And you'll hear me come back to these ideas all over and over and over, because the body doesn't break down on the outside. Like if you got hit in the throat and you got a sore throat, that's one thing. But if you haven't been injured in the throat and all of a sudden your throat hurts, it's because you have some type of stress you haven't resolved. So think about an issue too big to swallow, some type of idea, some concept, and something happened to your life and it's just hard to accept. Can't swallow it, metaphorically and intellectually. Or you can't speak your mind, can't speak your truth, can't say what you need to say, and it's stuck in your throat. Okay, that's what an elderberry syrup might be helpful for. Get you the information you need as far as why you might have a sore throat. You could have a different stress, like life doesn't seem fair, which life isn't fair if you didn't already figure that out. That can be strep bacteria imbalance that can affect the throat and things like that. There's a lot of different reasons why the throat can be an issue for someone. Next question. It's always good to breathe, right? Always remember to breathe. And always remember that life begins at the end of your comfort zone. Obviously, of course, these are probably backwards given the camera, but life begins at the end of your comfort zone. So I've dealt with a bunch of little kiddos that have had molluscum. Molluscum contagiosum is another way of looking at it. Basically, anything that shows up on your skin is a manifestation of what's going on the inside of your body. Like if you get cut and you get injured and you get a scar or something like that, that's a different story. You're going to deal with people who have acne or sunspots or eczema, psoriasis, and it all shows up on your body for certain reasons, right? It doesn't happen by chance. If you understand that, then you understand that molluscum it's technically considered viral in nature, and I can't say I found that it to be anything other than viral. I don't think that I've seen a trigger of mold or bacteria or even a parasite. It's usually viral, if I recall from case histories. But basically, it's a manifestation of an issue on the skin. So skin is related to, verbal abuse, feeling attacked, shamed, insulted, something like that. That's what the skin's about. And then there's other things related to that. I think I've seen cytomegalovirus be a pretty big trigger for molluscum. That's a good thing to remember. So CMV, not a hard and fast rule. Don't take it to the bank, but I've seen it commonly as far as people that are triggered or having manifestations of molluscum contagiosum. So the cause would be stress, honestly. If you don't have stress, you have no sickness. So stress first and foremost, it needs to be addressed. If it's a kiddo, it's usually the parent's stress. unless they've had something traumatic happen in their life, which is unlikely, but it can happen. But usually the kiddos are more sensitive to the parent stress. Remember, from birth to 7, you're just a feeling human being. You're just sensing the energy from your parents, and all women are mom and all men are dad, and they navigate their world based on that information. And that will dictate, at least in some part, how you navigate your relationships in the future. Is molluscum contagious? Well, viruses, much to the dismay or much to the misinformation you might hear as far as COVID-19, which is coming from SARS-CoV-2, which is the coronavirus 2, which is, in general, viruses are created by your body to heal your body. They're not contagious from other people. The information, the RNA that they isolated from the people's lungs in China is common to lung tissue. So they've never actually isolated a novel coronavirus. Your body creates viruses, whether they're RNA, which is corona style, for an example, or DNA type, which might be like a CMV, cytomegalovirus, or an Epstein-Barr virus. Those are, I believe, if I'm not mistaken, DNA-stranded viruses. But your body creates them and uses the cell mechanics, the DNA replication, RNA replication cycles in the cell to create viruses as a healing reaction in your body. So is molluscum contagious? That's a medical term, right? If you've heard me before speak on anything, basically ditch the diagnosis. Take the information and say, okay, we think it's this, and then leave the prescription at CVS or Walgreens or the hospital pharmacy and just walk away. If you want to get some better understanding, then find someone who can actually tell you what the root cause is. Because just because you have a symptom does not mean you actually have that. If you have a symptom, that's not exactly the root cause. You need to be able to dig down deeper. There's underlying issues there. Okay, so we'll leave molluscum contagiosum for that. Looks like next question is, what is a red swollen bullseye that appears after a tick bite? I think the proper medical term is erythema migrans, which is basically a fancy word of saying you got a rash. And it's commonly associated with a tick bite because that's what people have associated with causation. They don't necessarily know. I mean, if you think about anything, any insult to an area on your skin can bruise or can rash or can wheal, which means it's raised up and irritated. For whatever reason, they associate tick bites with the erythema migrans, okay, the bullseye rash. Incidentally, people have an association with Lyme disease and the bullseye rash, but only 20% of people that are bitten by a tick develop the erythema migrans. So it's not a hard and fast rule. There's no guarantee there. Ultimately, your body has been injured, like something bit you, per se. The body's reacting with inflammation, which is why it gets red there. Why it has a centered bullseye and then maybe a white ring and then another ring around that is what it kind of looks like as far as the nested circles, shall we say. That's hard to say. I mean, I couldn't tell you, other than basically saying that's your body's way of dealing with the different layers. So there's no real hard and fast rule. I mean, you could look at a medical definition of why it might show up as a bullseye, but that's just going to be somebody's attempt to understand it. One public service announcement: every single one of us, walking, talking, and breathing, has all the bacteria and other characters in our body to create what is called Lyme. I'll call it Lyme syndrome. I think I forget his name, but he calls it MSIDS. I can't remember his name. Doctor and MD calls it MSID, so it's multiple systemic infectious disease syndrome, which is, I think, a much more accurate way of describing anything that they might associate with Lyme. If you know anything about Lyme, Lyme is a town in Connecticut. There's actually Old Lyme and New Lyme. There's Old Town Lyme and New Town Lyme. Wally Bergdorfer, who was a University of Minnesota researcher, went out to Lyme, Connecticut, after a bunch of kids were getting sick and nobody could figure it out. And he codified a bacteria called Borrelia burgdorferi after his last name. And now forever, the CDC and other medical professionals will associate Borrelia burgdorferi with Lyme disease. Again, they isolated it one time in one town, and now they've seen sort of a trend after that. There are 500 that we know of. I shouldn't say, there's no hard and fast rule. Like 200 to 500 different types of Borrelia, and I believe 200 of them actually affect the human body. Looks like Jim showed up to join us this fine afternoon. Hopefully he's out enjoying the boat. So understand that we all have the potential to develop any disease. Lyme disease, one of them. I certainly have in my DNA or in my composition, shall we say, my neurological wiring, the potential for developing something like multiple sclerosis or something like that. But just because you have family history of it does never mean you're going to develop something. Less than 1% of illness is genetic, okay? So the environment triggers your internal environment to process things and develop things way more often than the external environment, okay? So your mind can trigger your internal environment to either heal something or cause disease faster than something in the environment. For example, we all breathe mercury in the Twin Cities and in the Minnesota area because of the coal-fired power plants in Bayport, Becker, and Burnsville. We're triangulated. We have one of the highest airborne mercury counts in the country. But not everybody walks around with mercury poisoning because when your body's able to detoxify it out, it's gone. It's not an issue. If you don't have any issues with shocking traumas from the past, dealing with feelings of unlovability, unworthiness, and things like that, you're not going to develop Lyme disease, or what we would think of as Lyme disease related to what would be called borreliosis, because there's also bartonellosis and mycoplasmosis and ehrlichiosis, and I mean we could go on and on, anaplasmosis. So it all is relevant to understand if your body is healthy and your mind is clear, you're not going to develop any diseases. Moving on to a question from Deb, says Himalayan salt rooms and salt inhalers, are they beneficial? Well, certain people have found great benefit from salt rooms and salt inhalers and things like that. The way I could best describe what I anticipate the main benefit would be is a cleansing of the airway. That's why when people are near the ocean, hey Jeremy, when you're near the ocean, you tend to have a cleaner airway, it's easier to breathe, maybe less mucus production and things like that. So when you think about your body's ability to cleanse the airway, break up any stagnant bacterial composites there that are stuck, if you will, then that might be cleansing for the airway. But generally speaking, I think people are healthier when they have some type of balance with the electrolytes in the air. Sarah has a question about animals develop limes. We had a horse with it and my dog had it. Right. So when it comes to animals developing quote-unquote Lyme disease, remember, Lyme disease is a diagnosis by a medical professional or by a veterinarian, right, who is a medical professional, but they have a specialty in small animal or large animal. So what they're finding is they're finding borreliosis or Borrelia in the bloodstream, which every animal has, every human being, other animal has. As a result, they're being labeled. Okay, they're not telling you why they have an imbalance of the Borrelia, the Bartonella, or the Mycoplasma, or any other bug that's in the body. All they're telling you is they're finding a higher count. So what you know about animals is animals are very sensitive to the energy and or emotions of their owners, okay, of their parents. We'll call them pet parents. And so what can happen is when the pet parent is stressed out and they're dealing with issues like we talked about before, of unworthiness, unlovability, shocking traumas in the past, and so on and so forth, that energy is picked up by the animal. Now, understand your heart is an electromagnetic radio frequency generator. So within 12 feet of me, 6 feet on either side in a circle, you can measure the electromagnetic field of my heart. And as a result, animals tend to like to cuddle a lot. So your electromagnetic energy, whatever vibrational frequency you have, whether it's upregulated, downregulated, whether it's jagged, smooth, coherent, if you will, is another way to describe it. The animal's going to pick up on that. Now, animals have their own stuff. I mean, they have their own DNA that came in with them. They have their own traumas from their past ancestors and stuff like that. So it might not just be your energy. You could be triggering something in them that could be causing it. Generally speaking, if an animal is labeled with something, you'd want to say, okay, first of all, check and see, well, what am I dealing with? What kind of stress am I under that they're picking up? Because animals, especially dogs, love to just, you could smack them on the butt and they'll run away, and 2 seconds later they come back and they're like, hey, they're panting and they're excited to see you, right? You could walk out the door and shut the door and 5 minutes later come back and it's like they never saw you, they hadn't seen you in a month, right? They're so excited. Ooh, I'm so excited, right? So they're just excited, and animals will take on one of their pet parents' stress, generally speaking. So hopefully that answers your question, Sarah. Let's go. Earwax. Deb's asked a question about earwax. Best and safest way to remove earwax. Well, earwax is a combination of things. Earwax is typically due to dehydration. It can be related to some fungal imbalances. You would be wise to see which ear it's developing in, because that'll tell you sort of what the relationship is like as far as who it might be, depending on whether it's your dominant or non-dominant side. So, for example, if you develop it more in your left ear, it might be more of a relationship with a challenge with a feminine personality in your life, and or if it was more someone on the right ear, right? It could be male conflicts and things like that. But the biggest thing you want to put in your ear is your elbow. Okay, you don't want to put anything small in your ear. Like people that use Q-tips, it's a terrible idea because you can actually impact the wax back into the canal, and then you have to have it dissolved. You could use hydrogen peroxide, provided you don't have a perforation in your eardrum. Some people do ear candling, things like that. There's a lot of different ways you can get it out, but there you go, next door. So excuse the noise. But yeah, make sure you're hydrated. Make sure your fungus in your body is balanced and things like that. And basically, just let it work itself out. Oftentimes, it'll fall out in your sleep. Don't be alarmed by it. But if you need help with it, just let us know. Deb's next question is, with summer, sometimes I eat late. She doesn't want to mention the time. She says, forget the time. What is the best food to eat past 7:30? Well, generally speaking, I would say anything that's not going to burden your digestive system. If you have ever seen our Vitality Food Guide, which is now called the Anti-Inflammation Guide because it seems simpler for people, but I think of it as achieving optimal vitality. Eating past 7:30, you want to keep it simple. Have some complex carbohydrates, a potato, some type of yam or something like that. Something that's going to be easy for your body to digest, but it's going to take a while for it to digest. Okay, so you don't want to eat a lot of heavy meat, like animal meat, protein after 7:30, and you certainly would want to avoid things like ice cream and a lot of fatty, sugary things after the time of 7:30 because that's going to overburden your liver and gallbladder and your digestive system, and you don't want to do that because that's going to throw off your sleep time. And because we're in daylight saving time right now, between midnight and 2 is your gallbladder's detox time. And then 2 to 4 a.m. is going to be your liver detox time. So you don't want to be messing up those times because a lot of people wake up during those times and they're like, why do I keep waking up? It could be from adrenaline dump from your liver, it could be you detoxing something, could be, keep in mind the gallbladder governs your deep sleep in Chinese medicine, from a Chinese medicine standpoint. Okay, so that's a good idea. Eat carbohydrates. If you have trouble waking up at night, then you might need a little bit of protein later on. So a nice gentle, get 2 to 4 ounces of water with a little bit of protein, a scoop of protein. And that'll be a slower breakdown in your body over nighttime. That'll be helpful. Let's see. Deb's next question is, best foods to heal, replace the microbiome in the gut. Green leafy vegetables are fantastic. They provide all the prebiotics and then feed the bacteria in your gut to create the probiotics in the gut. Okay. Hi, Jen. Welcome to the session. But yeah, definitely you can use fermented foods provided your body tolerates it. Tolerating fermented foods can be a challenge for some people. It might be a SIBO issue, small intestinal bacterial overgrowth. You just have to play with it. You got to figure out what's working for you and what's not, because that's ultimately going to determine your gut balance. But green leafy vegetables, a lot of fibrous foods, provided you don't have a lot of gas resulting from it. And then fermented foods can be great things for you to repair your gut, Deb. Okay? There's a ton of supplementation, but we don't need to go into that right now. Start with food. Let food be thy medicine, so said Hippocrates, the father of modern medicine. Let's see, Deb's next question is, someone she knows has dry, flaky skin that continues to peel and flake. Depending on where the body it is, that would help me understand a little bit more, Deb. Well, hold on. It's located between his eyebrows. The dermatologist said it's cradle cap. Cradle cap. I presume the person you're talking about is probably in their 50s, 40s or 50s, which means it's probably not cradle cap. Yeah, that's funny, cradle cap at a 50-year-old. Okay, great. So you have your liver lines here. We talked about this on the Wednesday Wellness Minute just 2 days ago. So you have liver lines here. I kind of have a couple. And then you have a spleen line right in the middle. Okay? So if it's between the eyebrows, you want to pay attention to spleen. Okay, spleen stress, ongoing stress, long-term immune stress, things like that. Dryness could be stress in the liver gallbladder, could be viral stress. That would where my mind would go because of the lack of hydration to keep the skin smooth and soft, because that's what your gallbladder does. It lubricates your skin by providing the bile acids to break down the fat in your gut so your body can reuse those. So yeah, that's a great place to start, Deb. Silver gel is great for that, so you're already doing some good stuff for him. You could do dry brushing on it to see if you can flake away that, but I would focus on spleen health, and I would focus on liver, gallbladder, making sure you have healthy bile acids coming out of there. That would be a great place to focus your energy. On to Hope's questions. Looks like her question is, it good to be sore after a workout so you know you pushed your body enough? Well, generally speaking, the most common scenario is called delayed onset muscle soreness, or DOMS, and that is pretty common. Usually it's the day after, and it depends on the level of soreness. If it's like, ooh, that's kind of tough to move, you hit a phase of hypertrophy, and you're actually breaking down some of the muscle tissue. So you're going to increase your muscle mass in that sense and grow more muscle by having soreness. Yeah, sorry about that. Electricians are cutting holes in the wall, so it sounds like the termites are coming through, but sounds of progress, we call that. Okay, so yes, it's normal to be sore after working out. Just depends on how much you push your body. Generally speaking, Hope, if you're not sore, then you probably haven't pushed your body to the point where you're going to get hypertrophy or any breakdown of the muscle tissue, so you're not going to get any new muscle tissue growing. But that doesn't mean that's not necessarily a good thing. You don't have to be sore. Okay. See if I can time my comments between the pulling of the electrical conduit. All right, so here we go. Is there a specific need to be filled if we are... Hold on. Is there a specific need to be filled if we are buying or shopping a lot? See if I can interpret that. Is there a specific need to be filled if we are buying or shopping a lot? I'm not sure, Hope, what you're buying or shopping a lot for. If you can comment, if you're still on here, about what you're referring to. If you buy or shop a lot, depends on what you're... Oh boy, got the Sawzall. Here we go. Let me know if you can comment on that, Hope. I know you're on our Insta family over here if you're still on there. Okay. Is there a certain brush needed to do dry brushing? You can just go to your local store and like Whole Foods, or even like Patina might have one, or local salon might have a dry brush. That might be good. Usually it's a firm bristle, and it's just you just want to be scraping. You want to brush toward your center line. Your downloads are your hands and feet. You don't want to push toxins necessarily to them because that's an energetic download. You want to bring everything back to your lymphatic tissues. So you want to dry brush up, and in. Okay. All right. That's a great thing to question for. If in the shower and wet, will it work? Yes. Basically, what you're doing is dry brushing is moving things toward your lymphatic drainage. Okay. So it's going to work no matter whether you're wet or dry, as far as I'm concerned. You're just moving things. You want to make sure you have a healthy liver. We talked about this at length in the past about having healthy detox pathways, emptying your bowels regularly, having healthy detox. You're not getting a lot of migraines or bloating in your gut or hormonal changes and stuff like that that might be indicative of having hormonal imbalances and liver detox challenges. You don't want to overload your kidneys and stuff like that, so you want to make sure your liver can handle what you're throwing at it. Okay? All right, what else? Sarah's got some questions here. Yes, Sarah says, I realize that hives are a symptom of stress, but what about small dots? Small dots of them that only appear in certain places, often like bug bites, except I know they're hives. Well, so yes, it's all about stress. Hives are almost exclusively related to your adrenals' inability to keep up with the stress you're under during that moment or ongoing prolonged stress. So you want to pay attention to where they're showing up. Like, for example, lower arm is inability to embrace or inability to get rid of something. Upper arm is inability to push back or inability to get rid of something. Torso is inability to overcome, inability to break through, inability to get through, carrying someone else's weight. Could be on the neck, which is criticism, stubbornness, or inability to understand. Shoulders, inability to get out of the way, inability to feel like you're successful in something. You might feel like a failure. The thighs could be feeling powerless, inability to be recognized, promoted, or appreciated. Lower leg is inability to keep up. I mean, the list goes on and on, right? It just depends on where it is coming up on you and how long they last. And so pay attention to what's happening in your life and what stresses are being you're being affected by, and then you'll be able to kind of dial it in and see, okay? All right, next question is, obviously, where they're showing up is indicative. Yes, we just talked about that, some kind of a trauma or stressor. Just, you can call it a stressor or a trauma. I mean, every trauma is a stress, but not every stress is a trauma, shall we say. Spatter in places seems weird for her. That's all right. You did a great question. So, all right. Well, she's giving me specifics now. Left torso would be inability to break through or get through with a female friend or family member of yours. Inability, or maybe carrying their weight. Sort of on the stomach. So the stomach anatomically is here. This is the stomach here. Okay. All right. Yep. Okay. Yeah. So jot some notes down. I'll continue answering these, Sarah. So stomach is here. Stomach is indigestible anger and frustration. Okay. If people think this is the stomach down by your belly button, that's really your abdomen. That's really kind of your small intestine reflecting out, because your colon runs up, across, and down. So you want to differentiate between your stomach and your transverse colon. Your pancreas is in there. Your liver and gallbladder right over here. This is on my right side. Liver and gallbladder here. So yeah, inside of the left thigh. So left thigh, powerless, not recognized, appreciated, or supported, and things like that. So that would be feminine. Of course, left side feminine, right side male. In the crook of the right elbow. So inability to push back, inability to oppose some male in your life. Back of the right hand. Hand is inability to let go or inability to hold on to someone or something. Okay. All right. So and then her next question is, how to deal with random hives, itchy bumps that appear in the same places over and over when I'm in between QNRT sessions? Well, first of all, you want to identify who you've been interacting with and what type of stressors. Who are you thinking about? Who are you interacting with? Who'd you get an email from? Who'd you get a text from? Who you get a phone call from? That'll help you understand who your trigger is. Generally speaking, usually happens pretty quickly after the incident where the stressor happened. You can do something called EFT where you do tapping. EFT has specific things, where you can tap, and so basically once you know the body part, you can say, for the hand, for example, I'm letting go of whatever stress is with that person. I'm letting go of feeling like my boundaries are overstepped with the male in my life, right hand, that is not recognizing my boundaries that I'm setting. That's off the thigh. I can break through this barrier. I can set a new boundary with this person, things like that. So engaging, like, break up the biochemistry. It's a biochemistry issue, right? Your body's having a reaction. So tap your thymus and make up your little affirmation, and that will short circuit it. Okay, that'll help faster. Okay, if you have any more questions, just let us know. So if someone has ADHD tendencies their entire life and has now been on multiple drugs, Adderall, Vyvanse, and they work for a while but wear off, how would QNRT benefit the person? So I was just reading about the trauma related to ADD and ADHD this morning. Incidentally, it's funny you mentioned that. So basically, it's a separation. It has to do with the stressor. The brain can't hold its focus on something because it wants to turn its attention away from something. And it's constantly being triggered, so it's turning away. And that topic triggers, so it turns away. And trigger. So your mind is trying to play dodgeball with these triggers. And so you find yourself enthusiastically focusing on something, but then you're like, I can't do it. I'm over here now. And then, over here. So, QNRT is definitely going to help that because it's going to help resolve the traumas in the brain, and it's going to help you be able to focus on things more. If that answers your question, Sarah. That's basically the best explanation I can give you. Someone with ADHD, ADD is darting because they're trying to avoid something in a mental processing state that's triggering them over and over. So they get triggered here, triggered there, and they're just dodging back and forth, trying to get away from it. Okay? Let's see how we're doing here. All kinds of fun stuff going on next door. Pipes hitting the floor, conduit being pulled. It's fun. We can't wait for everybody to see. I think Gracia's going to post a video. I did a walkthrough yesterday of the space that's under construction. They basically just gutted our entire space. And there's all new wall studs up, and we're super stoked about that. So next question is, I think it's from Sarah. During QNRT, we wear different colored glasses depending on what we're working on. Let me see if I can grab those without yanking this cord out. Hold on a second. Meanwhile, you can be serenaded by our construction next door. All right, and we're back. So these are the glasses she's referring to. Okay, so these are the different energy centers in the body, okay? So this is generally considered the crown energy center. This is the third eye. This is the throat center. So I'm going down the list here if you don't know. So violet is top, indigo is third eye, blue is throat, green is heart, yellow is solar plexus, orange is sacral, and then red is going to be underneath the root energy center, okay? Now you may not be able to read this because it's, oops, well there goes those. It's backwards, okay? I presume it's backwards, but if you can read this, great. So let's just talk about the highest energy center in your body where a lot of information and downloads come in. That's related to I know, okay? So it's top of the head, the pineal gland, cerebral cortex, right eye, central nervous system, and things like that, okay? So violet is related to balance in universal love, spiritual motivation, understanding, open to the divine, wisdom, idealism, selfless service, physical, mental, and spiritual harmony, and unity, okay? Corresponding color with this is typically yellow down here. Then we can go to indigo, just as another example. I'll read one more. And so indigo is the forehead, the pituitary gland, the left eye, sinus, nose, ears, and eyes. So indigo is related to balances inspiration, intuition, focus, concentration, insight, imagination, devotion, clear thinking, peace of mind, and ease in the now. Those are just a couple examples. Okay, red is of course down more on survival level. So this is higher level thinking and higher level consciousness. Down here is going to be sort of survival mode, and it's also the left occipital. So that's related to the base of the spine, adrenals, kidney, bladder, colon, spinal column, and legs. So it's related to I have. So red is balanced in relation to physical, survival, sensory, stable, secure, self-preservation, instinctual, grounded, primal, spontaneous, active, and courageous. Okay? So those are just some examples, Sarah. I believe that was your question regarding those. So it just depends on what your brain is looking for. Like, I can't tell you how many times people will come in with a certain colored shirt on, and when I test for the glasses, and I don't even pay attention to these things, I grab the glass and I'm like, oh, look, you have a purple shirt on. Oh, look, you have a red shirt on or a green shirt on. It's funny how that works. Basically, because your brain is saying, I need more coherence in that area. Maybe the vibrational frequency in your heart energy center is lower, so maybe you're having a strained relationship. Maybe you're feeling like too big a heart and you're feeling sensitive or vulnerable, so you need some support there. It just depends on what that is. That's the best way I can describe that for you. Yes, so we're attracted to different colors in our daily lives. That's absolutely accurate. For example, we wear what we wear, whether on a certain day or time, and how we decorate our living space, etc. Oh, and then she says, oh, and one more. Teeth health. How much of what goes on in our mouths, receding gums and cavities, etc., is strictly digestive, or diet rather, or genetics, etc., and how much is caused by trauma or stress? Okay, without a physical trauma to the tooth, it's like anything in your body. In the absence of trauma, the body breaks down on the inside before the outside. Now everybody thinks that the mouth is inside your body, but it's technically outside your body. So if you think about a breakdown in a tooth and you haven't had a trauma there, then you have a breakdown on the inside of your body. And my tooth chart is actually stuck to the cabinet, so I'm not going to pull that one off. But generally speaking, the molars in the back are going to be on the lower large and lung intestine. You get to the front, you got kidneys and bladder on the lower half. Let's see, upper in the back might be liver, spleen, pancreas, and the molars up there. So every tooth, if you just look up tooth organ chart in Google or DuckDuckGo or something like that, just type in tooth organ chart and you get a better understanding based on your teeth and what issues you might be having. It's fascinating. Part of what we're going to be talking about next week in the Wednesday Wellness Minutes is the tongue analysis and how we can correlate that with the face. And then we'll eventually go to the nails. So understanding the teeth. Hi, Gracia. Understanding the teeth is really important because if you have teeth issues and you don't have trauma, like someone kicked you in the teeth or you got, now I remember when I was in my 20s, we were out at like a concert with Chris Cornell, and I forget which band it was, but we were like a club downtown Minneapolis, and I was alongside the edge of this people going crazy, and like literally got elbowed in the face and busted a cusp off one of my teeth, and I'm like, oh crap, I'm gonna spit that out. Ended up getting a crown on that. I probably wouldn't have done that had I known better, but anyway, it is what it is. So in the absence of trauma, the body's breaking on the inside before the outside. If you have teeth issues and you haven't been hit in the teeth, then you have a digestive or organ system issue, okay? Keep that in mind. If your back teeth are rotting out, you might have a stomach acid issue, you might have a reflux, like an occult reflux going on, or people who have bulimia, gagging themselves, acid coming up, that'll basically singe your teeth right off. So there you go. All right. I guess I glossed over the whole part about genetics and diet. Genetics would come into the play of whether you inherited some sins from your fathers, which is basically you had stress come in on your DNA relating to your ancestors' stressors and traumas in their life. That can predispose you for different things, but typically it has to be triggered in your lifetime. A certain trigger has to occur in order to cause a genetic manifestation of some sort. And certainly your diet, I mean, you got to take good care of yourself. I know my dad said that he grew up on well water, and that's what caused his teeth to be as much of a challenge as he had. I think one of his quotes was that I have the equivalent of an automobile in my mouth. He's had complete reconstruction surgery, implants and whatnot in his mouth, and I know he attributed that to growing up out off the grid in a well, off well water and stuff like that. But you can survive just fine without fluoride and chlorine in your water, or the birth controls or the methamphetamines or whatever other crap we have in our water now that we're drinking and we're not even aware of. So your teeth health has everything to do with your insides and very little to do with what's coming from the outside. Okay? So our second to last question. Second to last question is, why do women get nausea when they are pregnant? So generally speaking, it's usually during the first trimester that it's most intense, and that's due to the spleen stress because there's a massive draw on the blood volume, and the spleen is working so much overtime, and the spleen and stomach have a direct correlation and connection as far as Chinese medicine goes. So when the blood volume drops so much, the spleen is working overtime, it just takes a lot of resources from the stomach, and as a result, there's not enough acid in the stomach to tonify the pyloric sphincter, also known as the aortic sphincter, at the top of the stomach. And as a result, that can cause a lot of reflux. Plus, there's a lot of estrogens coming out of the ovaries, uterus, and the breast tissue during times like that, and the overwhelm of the liver and gallbladder. Typically, the gallbladder can cause a lot of acidity in the small intestine, which push back pressure on the stomach, and then as a result, then causes a lot of nausea. There's multiple different things going on, but when in doubt, support your spleen, your stomach, and your gallbladder. When it comes to nausea, you might be anemic. You might need some iron support during that time. You might even need some iodine. Just depends on who you are and your specific needs. Okay. All right. Deep breaths are good, especially when you talk too much. All right. Next question is: do you need to give your child Tylenol for a fever? Unless your child's hitting 104 and staying up there for a prolonged period of time, you do not need to give your child Tylenol for a fever. It's well known to bring it down, but it's just masking the symptoms. Remember, a fever in your body or your child's body is your body's attempt to heal something. You're raising the temperature in order to balance out the microbiome, specifically usually bacteria, but it can also be viral stresses. So elevate the heat, your body tends to sort of calm things down and causes more cellular respiration. Looks like Ella's watching. Hi, Ella. And then that's going to cause a fever. So unless you're making a 104 fever and prolonging it for a long period of time, there's no reason to take Tylenol to lower a fever. Okay? All right, our last question is Mary V. Question about cookware, bakingware. What are copper pan? What about copper pans? Tefal. Not sure what Tefal is. Maybe it's a type of brand. So cookware, you want to be very careful about what cookware you're using. Okay. I would say use ceramic whenever possible. Cast iron is thought to be one step up from like a non-stick surface, one of the Teflon. Maybe that's what she's referring to, Teflon. But yeah, you want to be very careful because there's a lot of chemicals in these coatings that they put on these pans. I generally recommend we use at home ceramic covering for our pans. You know, people want a pan that's going to last their entire life. Like, If you have that case, then you've got some seriously powerfully toxic stuff on your pans, right? Or your pan, I mean, I would just never expect a pan to last your entire life. So have a proper expectation going into these things. Your pans are going to last a certain amount of time before you've cooked them to the point where they're going to stick something. And if it doesn't, then you should be kind of concerned about what, toxic chemicals might be on there. I mean, you see commercials all the time. They got these pans now that they're throwing flames on there. They're using a screwdriver on there. They're using a drill and stuff like that. It's crazy what they're trying to do to make these things marketing-wise. I can't speak intelligently about copper pans. I suppose there's possible for copper alloys to leach into the food, and copper toxicity can be an issue for some people. I don't have off the top of my head what copper toxicity might be related to, but remember, just minimize your exposure to everything. Try not to cook things that are, a gazillion degrees temperature. Try to stay, 212 and below, and or 350 and below, somewhere in that range. Frying things is just generally not good for you. Get trans fatty acids and advanced glycated end products, AGEs in other words, things like that. So stick to ceramic cookware as best you can. Don't spend less than you should. Spend a little more than you thought, than a little less than you should. It's really important to get quality cookware so you can actually have confidence that you're cooking food on something that's not going to leach chemicals into your food. All right? Whew, deep breath. That is a lot of questions. So I'll give a couple seconds here for someone to raise the hand or ask a question if they want. Otherwise, we'll wrap it up for today. Like Sarah said, sometimes you got to watch these things a couple times, or at least tune into the part that you're interested in. I know Gracia does a great job. We'll call it an expert job of providing that information as far as the breakdown, what minutes along the way we're talking about certain things, and that helps people not have to sit through the whole thing or listen to the whole thing. You can kind of jump around where you want to. I asked her to do that. I asked our team to do that because I think it's important. Not everybody's going to tune into the whole segment. They might be interested in this, that, the other, so that's why we provide that service for you. And we appreciate you spending your time on your Friday. It's beautiful outside. Might be a little warm. I haven't been out there since this morning, but it was pretty fantastic when I drove here this morning. So get outside, enjoy the beautiful sunshine. Hopefully it's going to be a beautiful weekend. We're doing a team building event tomorrow. We're excited about that. We're going down to Sand Creek Adventures down in Jordan, do some zip lining, some fixed ropes courses, and have some fun as a team. We spend 5 days a week here together, and we have a lot of fun while we're here. But for us, it's important to get out and, for the ladies, let their hair down, because obviously I don't have that issue. But, have some fun and, commiserate and just enjoy time together outside of here. So we hope you enjoy time with your friends and families, your loved ones this weekend. We're excited to see you next week for the Wednesday Wellness Minutes. We'll be bringing you part 2 of the 3-part series related to face, tongue, and nails. And we'll be talking about tongue. Tongue analysis, we'll draw some correlations between the tongue, and then we'll wrap it up the following week with the nails. And then, of course, we got to get back on track. I kind of told you we're going to go to poo next week. Actually, it was, next week. But it's actually going to be part 2 of the hair, tongue, and nails. And then we'll go a couple weeks from now to talk about poo, because everybody needs to know what their poo means. Okay? So for now, we'll sign off. Appreciate you guys tuning in. Appreciate you sharing. Yep, thanks, Sarah. We appreciate you tuning in. And we'll see you next Wednesday for the Wellness Minutes. So everybody have a fantastic weekend, and we'll talk to you soon. All right, take care. Bye-bye.